Hello and welcome to the Nurse Rosa's Insights podcast. Today, I get to speak with Rebecca Love. Thank you so much for joining me today.
Rosa, it is so exciting to be here with you, and thank you for having me as a guest.
Well, it's about time that Nurse Love and Nurse Heart got together.
That's so well said. Yes.
I was like, what is a corny way I could say this that would rhyme or something, but I couldn't think of any kind of rhyme, so it'll have to do. But yeah, we've met in person several times, and you have been so incredibly inspiring for me and supportive of me and let me know where Mark Cuban was so I could accost him.
Rosa, I have to tell you, it's what I love is meeting nurses who have that energy and passion to change the world. And it's hard in healthcare not to be so broken down and beaten down by the system and just by the way the world views nursing. And so Rosa, every time I have met you, you just exude the energy that we need in the profession. And so I am glad that we know each other. And honestly, I'm a big believer that you pay it forward and you elevate and you amplify because a raising tide helps all nurses accomplish more. And if we can do that, I just think we're going to change the way that we're going to deliver everything in across healthcare.
Well, I absolutely believe that. And I can't get over hearing you say that. So I do listen to your TED Talk every now and then when I need to pick me up. You were the first nurse to be on the big TED stage, right?
Well, I was on a TEDx stage, which was yep. And what happened is with that the story of how TEDx works is that a certain percentage of any TEDx platform can nominate one of their speakers to be featured on TED.com, and that's
Oh,
how you now go on the TED platform. And I was fortunate enough that now my friend John Werner, who runs Boston TED, used to be Speak and Street TED. After I spoke, decided that everybody who was in the audience voted to have me put up on TED that year. And that changed, I would say that event changed a lot of the course of my life, just in terms of people recognizing and seeing nursing and then engaging with this idea and concept. So it was a life-changing event for me, Rosa. But I appreciate that you watch it. I've never been able to watch myself on it. I think like anyone, it's really hard to hear yourself. But I have to tell you, Rosa, it was my 10-year-old daughter who every night would listen as I would practice that speech in her bedroom. And I was like, I can't do this. I can't do it. And I remember her looking at me and saying, but mommy, I really like it. And, it's funny, Rosa. Like, I think we all, I think people think that people like you and I have things figured out, that we've made it. And I can't tell you the amount of imposter syndrome or the things that I don't know what I'm doing and how often I fail and how often even criticism still wears you down on your shoulders and you just keep pressing forward. And so I appreciate that you watch it and that you've seen it and that it inspires you because honestly, it wouldn't have ever happened if I hadn't had my daughter pushing me forward to make that happen.
what would we do without our kids to make us better people, even if it's uncomfortable? Yeah. So, you have done a lot with business as well as with nursing. You have a bachelor's or an MBA, is that right?
No, I have a bachelor's in international relations. I actually have my BS and then my MSN in nursing. So I went back as a nursing as a second career choice. Thought I was on my way to law school. My mom's a nurse, and she flew out and she said, "We're not going to support law school. We think you should become a nurse." And she
Oh,
was a nurse, and she had said to me, "Rebecca, there's plenty of strong lawyers in the world, not enough strong nurses, and I need you to join nursing." And so I agreed to apply to one nursing school. And lo and behold, here I am years later on a podcast with you talking about nursing. So moms have those premonitions just like our kids. And here we are, Rosa. But I don't know about you, but nursing wasn't something I wanted to do from a young kid. And honestly, I struggled with it even after because I felt so disempowered so often being a nurse in the greater healthcare landscape. And I think that's why I do what I do today, is to really fight the fight to get nurses into places that they aren't, but also elevate and amplify the intelligence and nurses bring to healthcare. And it's a personal mission for me, exhausting as much as it be. And I see why so many colleagues of mine across healthcare that study nursing leave the title nurse behind with them as they move across the spectrum, because I don't think that the title nurse helps you in your career to advance in places that are non-traditional for
yeah.
nurses to be.
Yeah. unfortunately. But, we can help with the branding of that. And, I think you bring some of those lawyer like skills because you're essentially making a case for nurses as innovators and nurses as like entrepreneurs. And so, do you want to talk some about that? Because I love how you describe how nurses have always been innovators since the beginning.
Rosa, I appreciate it. And I think that's where my career started in nursing to really amplify it. It was I was recognizing nurses were doing workarounds and making things happen, but they were never allowed to change the systems in which they worked. And that's how we led to the first hackathon. That's how we started Sanciel. And I think the entire thing is that what I've always realized about nurses is when they are trying to fix something, they're innovating to make life better for those around them. And so they're the truest of innovators. And to me, what we never were taught was business. We were never taught strategy, operations, finance, how to speak to a P&L, make a decision about money. Because honestly, most of us as nurses, money is a dirty word. Like you should not be making it as a nurse. You should be doing more with less. You should not even worry about the finances, but we're going to staff you to the lowest cost denominator in all scenarios. And I think where my love and everything has gone is that I truly believe that if nurses could be in those spaces to create real solutions, we would actually see outcomes change across healthcare for the better. And it's where my career started because I saw the void. I wouldn't say the nice thing is we started that and it's taken legs of its own, and it takes a long time for a movement to start. But now I've been able to turn it over to other people to lead and see it sprouting up. And honestly, people much better in this space than I ever was, who have been 10 times more successful in business than I ever were out there leading these kind of things. So, Rosa, that's what I love. And I love seeing nurses be successful out and go out and do things for themselves and for others to change innovation in the future of healthcare.
Yeah. And we're not going to go in depth about it, but I'm definitely going to give you a shout out for starting the Commission for Nursing Reimbursement. And I think those are really important conversations to have. And now there's a lot of talk around, like, was it API numbers or NPI numbers to track?
National provider identifier numbers, which are invisible because we can't track NPI numbers, are what determine the kind of reimbursement in any EMR or EHR system. And also are the NPI numbers are basically what Medicare and Medicaid use for reimbursement of the services that are provided for you. So nurses aren't provided them, except, let's be very honest, give a shout out to the state of Oregon, who actually did get the first ever reimbursement through Medicaid patients to get reimbursed. So that's a major shout out. And no, I appreciate the recognition. I know you've had several of my colleagues on talking about, and that's the marathon in my life. Fighting to get nurses unbundled from room rates will be the fight of my life, because I truly believe that when when you're a cost to systems, just like in any business, we cut costs. And that's what we've done to nursing for generations. And until we change that model, we're not going to effectively change the ability for nurses to be able to articulate or elevate the profession in ways that are being hindered simply because of a cost structure model that has kept us from being able to quantify that value meaningfully.
Yeah. And you used a Q word. So I think I should ask you about where you're working now.
No, well, thank you, Rosa. So, for the last year of my life, I've jumped into the world of AI. I work as the chief clinical officer for an organization called Quadrivia.ai. It was founded by a man by the name of Ali Parser, who was the former founder of Babylon Health, which had quite a rise until it didn't, and then also Circle Health Group. And I have to tell you, I haven't been very public talking about AI and nursing, probably because I actually just was thinking about this today, because I didn't think myself knowledgeable enough to join the conversation, but I think that's a mistake. And actually, Rosa, I'm deciding to come out much more publicly with regards to nursing and AI and the things that I'm learning, because I have to tell you, in the role that I've been at with Quadrivia, a very small build up startup with a lot of potential and significant impact in the world of Gen AI, as we're building one of the leading clinical AI assistants in the world. I know this because we're launching 4 countries at the same time, and the amount of responsibility that the team reports into me. I oversee all clinical and client operations, and most of the physicians and nurses on my team to report directly into me. It has been a learning curve of tremendous proportions, at which I find I have learned skills that I never thought I would need to know. I think those are things like that, but also the evolution of what is coming for our profession is
Mm.
vastly different in a future than what we know today. And
Mm.
I think for nurses, many of us, because also I teach and have helped build and lead the first AI MSN track in the country at FSU, we spend a lot of time educating around ethics and bias, but I think the industry has moved well beyond those conversations where nurses are, unfortunately. And we really need to accelerate the adoption of new processes. And I think Rosa, you mentioned earlier the partnership that we are doing with AAACN, which is the American Ambulatory Association of Nursing.
Mhm.
And why we started that partnership was to bring nurses in to learn how to do AI prompting, to do validation, evaluation, and building these tools alongside of us. Because I think a lot of the conversations in AI is about replacement of a workforce. And I strongly do not believe that we can replace nurses. So it's really trying to articulate and work with the leading body in ambulatory space because our platform deals with phone call based communications,
Mm.
bringing those nurses in and teaching them how AI is being utilized in AI prompting has been a really interesting experience, and also really well able to articulate where is the role of AI, where does it begin and end, and where does the role of the nurse always stand as the human in the loop in these conversations. So it's been dramatic and exciting, exhausting,
Mhm.
and a learning curve. So thank you for letting me talk about it. And I would love to get you. We should have a larger conversation in the future around AI. And happy to
Yes.
introduce you to other colleagues of mine who I think are really forging forward in this space as some of the leading nurses at cutting edge moments.
Oh, definitely. And yeah, I was so encouraged to see that Quadrivia AI was partnering with a nursing association in order to really put it to the test to train the nurses as well as to train the AI so that they can learn and grow together to actually build something where nurses are involved from the beginning instead of trying to find a workaround for the AI.
And let me tell you, they are going to do it. And honestly, really interestingly, there was a post today by Jennifer Mesnick, who is, as we know, the president of the American Nurses
I
Association.
saw that. It was so good.
It was, and it was about how she's sitting with some of the smartest people in the world. My assumption might be out at JP Morgan or one of these events. But she said the industry is not even paying attention to nurses. They've moved so far in advance. And that was why it was central to me as being the chief clinical officer that very early on I would be working with nurses to establish this. Because the truth is the technologists don't need nursing and they don't believe they do. And the industry to fund it doesn't believe that. And I think that we must start forcing and changing the way in which we engage, but also recognizing that AI is it's not going to fit into the models that exist today. It's going to redefine the models. And that is something that I think is really hard for us as nurses to understand is that the work we've always done, the workflows we've always done are going to be greatly disrupted. And either we can be there to influence that or we're going to unfortunately be left out of those decisions. And I don't know if you saw, Rosa, but just in Utah, for example, a company was able to bypass the FDA to be able to do, they registered as a medical provider to
Right.
be able to do recertifications and basically prescription refills
Yeah.
as a machine as a provider. So they skipped the FDA altogether and
Mm.
were able to file as a medical provider for the next 10 years and circumvented that system. So if we don't think this is coming and change and there's going to be loopholes, we're kidding ourselves. So I would just say to all nurses listening to this, get involved, reach out to anybody working in an AI, and recognize that the typical stances that we have putting our heels in the ground and not doing it, people are just going to circumvent the work we do to manage what's going forward.
Yeah. It's oh my gosh.
A lot there.
I think what Jennifer said in her post today was really well put in that you were mentioning that it was how we try to work within the systems that are established, but we really do have to build something new from the ground up because we are working with tools we did not have access to before, and it's an entirely different paradigm. It is not just we're going to install this new EHR.
No.
And so I think it's going to be shocking to people as these things just get rolled out all around them. And
They are, and to the point of what you were saying is that there's a new paradigm that is coming, and it's being written by everybody besides us. And unfortunately, I wish to say that we had a scope of practice that was defensible, or there was a moat built around it, and I'm not sure that there is. And so, I think the reality that we have to look at is it's not only us. It's happening for physicians. It's happening for lawyers. It's happening. The world of AI and the age of AI, I think, is going to be the most disruptive that
Mhm.
we have seen. And the potential for good and
Oh,
evil. That I think we need more nurses involved. Where we started our conversation, nurses are not only the truest innovators, but they also are one of the people that I believe tracks a core metric of ethics and morality in our society that we don't see in many other professions.
yeah,
And we need that. We need
right.
that, and we need them into that. And I think that's the goal of where we're going forward. And so, Rosa, when you're looking, I mean, I know that you yourself have with everything that you're doing, you're having a pulse and you're seeing the world, you're going to these conferences, you're engaging with the best and the newest innovations that are coming out there. And I think we need more nurses to be doing exactly what you're doing, having and starting their own podcast, having conversations like this, but also exploring the world outside of our traditional past, because it is when we start to step out there that we start to be able to make the impact and the influence that is necessary for us in nursing to rise to a new level and break those glass ceilings of what we've existed in.
Yeah, and I don't know about you, but it seems like the nurses that do go stay in their nurse zone. Like we've got a beautiful nursing pavilion for nurse innovators, and that's a great place to celebrate. But to think that the nurses only need to go to the nursing track and not be in the rooms where all these other conversations are happening really defeats the purpose of being
Mhm.
there. There needs to be a more integration. And I think Health and now Vive are doing things like that and
Yeah.
weaving things in together. But I've seen it with this podcast where it says Nurse Rosa's Insights. And so everybody thinks this is a podcast for nurses. And I'm like, nope, I'm the nurse and I can talk to literally whoever I want. If they have a good idea, they could be Joe Schmo off the street. But if they have a $1 billion idea that could transform healthcare, I want to hear about it and I want to share it so that somebody can grab it and run with it. And I really want people to step outside of the boxes that they put themselves in, where they will just stay in their lane, in their bubble with the people that they already know.
Yes.
But you and I both know that if we always do what we've always done, then we'll always get what we always got, right?
That's exactly it, and the things will always stay the same. And so, Rosa, I think that's the advice. And I know you and I both love Health and Vive because it is breaking in and allowing nurses into equal access to events and spaces that we normally are not. And many of the other conferences, to your point, what you're seeing is they'll do a nursing track in another building on another side in another day. And I think those are the things that have to change. And people like you and everybody jumping in this bandwagon are changing those things. And
For sure.
the world needs more nurses, and I think the truth is that we need them at the bedside. We see the nurses at on the largest strike in U.S. history in New York with 15,000 nurses off for one of the largest strikes that are going to go on, and we know Kaiser's coming right on the back end. So we know that nurses are gravely unhappy at the bedside. They're not feeling supported. They're not feeling heard. They feel like they're being staffed to unsafe levels. And the truth is we need to reinvent how they are effective in communicating and speaking out on behalf of the needs that they need. And I think some of those ways are when more people like you and me and other nurses elevate into places of industry that can have the conversations and change the national narratives and learn to speak the language that we were never taught as nurses, because nobody's going to learn the language of nursing. We must learn how to speak business and finance. And it is hard and it is complicated, and it's because we were taught with how to save lives and to put everybody before ourselves. And business is not about putting others first. It's about putting yourself first. And I think it's an inherent imbalance in many situations, and
Cool.
one that nurses excel in from the perspective that they bring balance and they bring compassion to environments that otherwise would sometimes miss those.
Yeah. And another thing that is a misnomer about nursing is that it is a STEM field. And so, how about we talk about why is nursing not getting the same funding as STEM field degree programs?
So Rosa, I think and thank you for bringing this up. We founded the Coalition for Nursing as STEM about 2 years ago, with the eye that nursing is not classified as a science, technology, engineering, or mathematics degree. And why that is not is in 2019, a group of nurses prior to the pandemic also had gone in and asked for classification of nursing as a STEM, and it was denied. And what we've heard from the lobbyist on Capitol Hill who supports this effort with us, he was told that nursing is a soft science. We follow everybody else's science but our own. We are not able to think independently or act independently, and therefore are not classified as a science. Now, since that time and since the pandemic, as when we know that everyone who was not at the bedside as nurses largely sat behind screens and did everything, nurses were innovating using engineering, mathematics, and specifically science to challenge conventional practice because much was failing us. We made a very strong case to reapply for nursing as a STEM profession. Now, interestingly, there's two organizations in the United States who own classification of STEM. One is the Department of Education will hold that, but really it is the Department of Homeland Security who owns the classification
What?
of STEM. I know, who would have thought that is the
How does
Homeland
that
Security?
make any sense?
It doesn't seem to, but it comes down to visa applications. STEM degrees get preferential visa applications to come into the world. That's why you see so many foreign engineers, you see so many foreign scientists come into it, because their visa process is classified as a STEM, accelerating their ability to access and enter the United States for work permits. So therefore, they have not classified nursing as a STEM. So a year ago, we put this in. We actually heard that we made it to committee. We have not heard final ones, but we've actually heard that it is up for debate. However, with the recent issue going on in the Department of Education, which is not going to classify nursing as a profession because of student loan limits, we are concerned that nursing as a STEM classification is also at risk. And I think this speaks directly to the issue of what you were addressing, which is there is a classification of nursing that does not create us on equal level or par with many of our healthcare professionals or subsequent degrees. As such, we neither can receive reimbursement for our skill sets. We can neither achieve the same level of student loan funding of other professions, but also we cannot receive the same access to investment by the federal government into our profession. So by nursing not classified as a STEM profession, we cannot do residency programs. We cannot qualify for STEM grants, loans, or research projects. Most nursing research projects cap out at the top of $250,000 because they don't consider that their research is profound enough to have impacts. So this is a very significant thing. How a profession is classified and defined leads to direct funding and initiatives behind the scenes. So some people may say to you right now, well, it's not a big deal. I mean, nursing was never defined as a profession anyway. The reality is actually it was. It was on a definition classification list that was very important to access student loans. And by not being classified as a STEM, we basically are locked out of numerous opportunities. So for example, many of these conferences, Rosa, that we want to attend as nurses, they fund scholarships for most organizations to attend for no cost. Nurses can't go to these conferences because they do not classify as STEM. And as such, it is a full dollar cost. Now, it also achieves to everything else besides grants, residency programs, student loans, etc. And honestly, Rosa, I just was talking to a nurse recently going back to grad school, considering a master's in nursing and a master's in engineering. She chose the master's in engineering. Why? Because 90% of her loans were covered as a STEM profession, which she had no cost to herself. So this is, to me, is a fundamental fairness issue. I do this not on my own. I would have to give a shout out. Marion Leary has been one of my greatest partners and advocates in life, and she's fought alongside me on this, and alongside Jason Garbarino, who is the executive director of the Nursing as STEM Coalition. I don't think we're going to win it, Rosa. But what I would just say to anyone listening is that there are many things we need to fight for in nursing. It is a marathon, not a sprint. Let's keep going. And I think that's what we do. Or that's what I've tried to do. At some point, I don't know, I joke, Rosa, I'm getting old. And I'm not sure how much longer. I'm looking forward to the next generation, you and others that are going to come up and keep amplifying and do a better job of the things that we've started to keep going and drive that change forward.
I don't know. I think we might be the same age. So I
think we might be too, but I need your skincare regimen.
Yeah, that's okay. I'll tell you my dermatologist. How about that? But, the light helps too. but yeah, you're right. We've got to invest in the future nurses, because they're the ones who are going to have to do a lot of that heavy lifting in fresh droves. I think it was from you that I realized that the average tenure of a nurse at the bedside in a hospital, in a given hospital in the United States right now, is 2 years of experience, whereas before the pandemic, it was 15 years experience was the average of a nurse.
I think it was, it's down to 2.8. I think it was 6 years prior to the pandemic. Actually, 6 years was the average. So 50% of people had, experienced more than 6 years and 50% under. And
Yeah.
now it's 50% of people have experienced less than 2.8 years and 50% over. And we've
Oh,
never seen this level of turnover and that low level of proficiency at the bedside. And they're dealing with the most critically ill and sick patients that the world has ever seen. And I don't think it's going to get any better anytime soon. So we're producing, to your point, Rosa, we produce plenty of nurses, 185,000 graduates a year. We don't retain them. And we
mhm.
don't retain them because there are costs to systems. We don't have a STEM classification, which means there are no residency programs or programs to do those things. And on average, a nurse's increase in salary is only 1.4% per year, less than half the cost of living adjustments. So, I mean, the truth is your return on investment from paying for your student loan is going to take you 30 years to pay off. And which is part of the argument on the Department of Education that why they don't want to increase and classify as a profession is because if you take out that level of student loan debt to achieve that, your earning capacity over the course of your career, you will never be able to pay off those student loans based on how much money you will earn, either as with a bachelor's degree, nursing degree, or a graduate degree. And I think those are important conversations, ones we're not having enough of. Because we don't make enough as a degree to qualify as a profession based on our earning capacity.
Well, it's not just yes, that is definitely part of it, but it's not just that, right? Because theologians count as a profession and they get to keep it and they get to take out those loans. You know why? Because they were never going to get it written off by the government.
It's such a good
Okay.
point. Yes, good
They
point.
get to keep
Point.
paying on it. And what nurse practitioners who had their student loans and they would go work in a rural area would get their loan forgiven.
Yes. Yeah.
So those who were never eligible for forgiveness get to keep their debt.
This is so interesting. I mean, there's so many layers of the onion here, Rosa, and learn more every single day. So I
Right.
appreciate that.
Well, you said you wanted to learn more about religion, so
That's right. I'm going to be looking at that more carefully. So thank
right?
you. Ah,
Is
but
it
no, yeah. But
no.
Rosa, I think that the world of nursing, and to your point, is fraught with policy decisions that have limited a lot of the things that we're able to do. It's not because we haven't wanted to do them, but really history has shown that as a largely female profession, there has been distinct efforts by policymakers to limit the influence and the opportunities that nurses have. And I don't think that we can be remiss to recognize the roles of the American Medical Association with regards to the things that sort of currently are existing in our system and how we must do those things. And it's not just our profession, but we're looking even at pharmacists and others who are fighting for full practice authority and also expansion of their roles. And even in full disclosure, the American Medical Association, I believe, has just launched 185 new reimbursement codes, many of those aimed specifically at digital health and AI reimbursement. So they've been able to figure out a way to reimburse for those two organizations, but they've never been able to figure out a way to reimburse for nurses. It is definitely an interesting time for all of this because AI in large scales have largely failed because there is no return on investment. But we know that every single time nurses return investment to their hospitals. So,
Exactly. And this brings us to the $1 billion question. So, anytime someone comes on the Nurse Rosa's Insights podcast, the question is, Rebecca, if you were given a grant for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
yeah, no, Rosa, I love that question. Thank you. For $1 billion, which is a significant amount of funding to go and deal with an issue to create sustainability, yeah, I would divide it into two different parts. I think one, I would like to remove the barriers for physicians and nurses to own and operate hospitals. I think that would be one significant one. And two, I would like to implement a strong policy around the Centers for Medicaid and Medicare Innovation to formulate a new model to unbundle nurses from room rates and create a reimbursement model that supports them. But lastly, also, I think the issue facing our current country and the current situation around millions of lives. I think I saw a report today that over 1.6 million Americans did not re enroll in Obamacare or the Affordable Care Act because of insurance coverage. I think we know that healthcare and insurance is broken in this country. And I think the reality is it's the only people that are making money off of this, even though they claim to have no percentage of margins, is our current healthcare insurance system. I think we need substantial focus on creating a model that allows consumers to have direct access to healthcare in a way that sustains them. And if that means universal healthcare, which I still think is probably the only way to move forward, those would be the things that I would be looking at. And so I think we need for significant healthcare reform with regards to insurance, possible universal healthcare. But if we were going to do anything differently, allow nurses and hospital and physicians to run and own hospitals and create a model that finally underbundles nurses from the room rates that will actually drive forward sustainability of our workforce at scale.
Exactly. We just got to demonstrate that it can work. It really can. We just have to let it. And so thank you for casting the vision and for bringing a lot of nurses along with you. And you're not alone in all of these fights. I really love how you build a community around each issue and bring in other people um, to carry on the different torches because there's always more. So you
There's
can't.
something else. And honest, I appreciate you seeing that and saying that, Rosa. I've never been one who believes that I have to own the things, but what I often find is that stepping across and taking that first action is very, very hard to challenge the status quo. For me, I like starting things and passing the torch for other nurses to be more successful and rise up and do those things. And there's always, as you say, another issue that needs somebody to take attention to. And lucky for me, I've been able to do a few of them. So
Yeah.
thank you.
Well, thank you. And if people want to reach out to you about any of these issues, is LinkedIn the best place to do that?
Absolutely, Rose. I know sometimes it's hard to get a hold of me. You can also track me down at my company's website. I'm not going to give my direct email right here, but it's pretty straightforward. You can certainly go to quadrivia.ai, find a place to message me, if not on LinkedIn. So thank you for having me.
Oh, it was a pleasure, as always. And for our listeners, if you've enjoyed this episode, please like it wherever you are listening, or if you're watching on YouTube, feel free to comment. Let me know what you think. And if you have an idea for $1 billion solution to transform healthcare, I want to hear about it. Feel free to email me. It's info@nurserosaspeaks.com. You can find me on all the social media channels at Nurse Rosa Speaks. And I would love to hear from you. And until then, oh, I guess I should put it out there. I did publish a book partially inspired by all of this, right? It's called Speak Up, Start Now. It's on Audible and Kindle. And I'm offering hard copies when I go to speak at events. So I hope I'll get a chance to share that with every nurse in the United States. There are 6 million nurses. I'm counting LPNs, by the way.
Mhm.
And I want to get it in all of their hands because it's literally about overcoming imposter syndrome and leaning into our expertise that we get from experience, not from whatever letters are behind our name. So I hope that will be encouraging to all of you. And I'll see you in the next episode.